Dr. Laura, massage addict, and we're here today to talk about a funny thing called tennis elbow. If that was you, pain right on the outside of your elbow, maybe a little bit of radiation or tightness into these muscles. Very rarely does it go up, but pain with activity. So pain with turning, twisting, gripping, or in the case of a racket sport, it's very painful to do that overhand. This is called supination, anything that does this. Again, doesn't have to be caused by tennis elbow in many tennis playing. In many times it's not. What it is caused by, let's talk what it is first. Lateral epicondyle, fancy name for bump on your elbow. That is where the tendon inserts and we get micro tears right at the point of attachment. That's really what epicondylitis is. Anywhere there's an itis, it is inflammation. So it's inflammation, irritation of the attachment of that tendon into the bump. That's it. And it can be really noticeable in, yes, tennis players, badminton players, pickleball, anything that does this. Okay, anything, if you have a repetitive job, you could be a factory worker, you could be on the line, you could be working in the automotive sector, doing something repetitive, maybe you work at Amazon, you do the same thing over and over 162 times in a minute. Repetitive computer work can even do it with not enough time in between. So tissues have to rest to heal. And if we don't have that, and the load of the day, the load of the job is greater than the body's ability to heal and rest, that's what can cause it. That's what it is. That's what can cause it. We've gone through what the symptoms are. Burning pain right in here. And you know what? It makes everyday activities very, very painful and very irritated. Can affect even when you're sleeping and you roll over it. So what are some treatment options? Well, the first thing, if you notice you have it, try to stop doing what aggravates it. Now that's easier said than done, Dr. Laura, because you can't entirely rest your elbow. If you are in construction and you are in flooring and you nail repeatedly, either with a nail gun or a hammer, that is what you do every day. Just be very mindful of the amount and time you do that activity with enough rest. Second is ice to help with the inflammation and pain management. Stretching and strengthening, yes. There's going to be an imbalance. Some muscles will now work less, some muscles will now work more. We have to balance those muscles. So we have to stretch and strengthen the muscles around. Maybe even some bracing and taping of that area. Now, how can chiropractic help? Dr. Laura, I thought chiropractic was just about the back. Well, if you've been around here long enough, you know the chiropractors have a breadth of knowledge in what they can assist with. This entire, we call it an upper limb, can be affected by a little pain here. So we can assess wrist, elbow, shoulder, neck, all the way up. Again, muscle imbalances, stretching, strengthening. Maybe adjustments are necessary and maybe mobilizations are necessary. Again, the expertise of a chiropractor. So mobilizations and adjustments, postural assessments and understanding, stretching and strengthening of muscles, and if the chiropractor does other therapies, be that muscle stimulation, so a TENS unit, be that ultrasound, be that acupuncture, be that bracing, maybe if they don't, they can be part of the team approach to guide you to the right person. Maybe it's in the massage addict network that can offer those services if the chiropractor can't. So the chiropractor can really be the team lead in cohesively giving the right direction. So I know it's very, very painful and you're like, it's gonna last forever. There is hope with consistency that this will get better. So your next step, if this is you and you're interested in getting support from a chiropractor, call up a local massage addict. Do you have a chiropractor? I'd like to make an initial consultation, and they will do the full consultation, exam, postural assessment, range of motion. They'll give you their best diagnosis and their best suggestion and plan of management. So hope this was helpful. Dr. Laura, tennis elbow.